I'd love to talk about high ferritin. I find ferritin to be very interesting because in the low or normal ranges, it can be a very accurate reflection of our total body's iron stores. However, when it is elevated to levels of 300 or greater, it makes me think of two main possibilities. 10% of people with elevated ferritin will have a true iron overload state, meaning that their body has excessive iron present. The other 90% of patients with elevated ferritin will have some sort of inflammatory process going on that is elevating their ferritin through inflammation. The iron overloaded states are typically representative of a genetic disorder called hemochromatosis, in which iron absorption is unregulated by the body and takes in excessive iron. The other people that will experience iron overload are patients that require frequent blood transfusions. So these are usually patients with sickle cell disease, blood or bone marrow disorders, essentially anyone that requires more than 3 blood transfusions per 30 days. In order to determine if a patient has a true iron overload state, the next lab you're going to want to look at is called the transferrin saturation, or TSAT. If this value is over 45%, there's a high likelihood that this represents a true iron overloaded state, and the patient should be tested for hemochromatosis if they're not receiving frequent blood transfusions. Okay, so what about the other 90% of patients that have elevated ferritin? Whenever ferritin is elevated, it can be a very sensitive marker for inflammation. Whenever I see someone that has a ferritin above 300 and I'm suspecting that it's coming from an inflammatory state, I typically think of these inflammatory states as two separate groups. The first group will typically have a ferritin level between 300 and about 1,000, and these are kind of the more chronic inflammatory states. Most common causes of this type of inflammation includes any type of liver disease, including intake of toxins like alcohol, hepatitis, autoimmune liver diseases, as well as non-alcoholic fatty liver disease, now known more appropriately as metabolic associated steatohepatic liver disease, or MASLD, as well as diabetes and even obesity itself can cause elevated ferritin. There are also a few autoimmune diseases that will cause this level of ferritin elevation, including rheumatoid arthritis, inflammatory bowel diseases, and other inflammatory arthropathies. Now, for people that have a ferritin level of 1,000 or greater, I'm usually thinking of things that are a little bit more sinister. Things like cancers, active infections. Often people with critical illness can have a highly elevated ferritin due to all the active inflammation. And then there are kind of the extreme levels of elevation above 10,000 or more, which is typically representative of a very rare condition called HLH, or sometimes adult onset Still's disease, both of which are extremely rare and typically land you in the hospital, if not the ICU. So within primary care, I typically don't see this degree of ferritin elevation, but I do commonly see the kind of 300 to 1,000 group. Thanks everyone for listening. If you have any additional questions, feel free to leave them in the comments below.